a lot of the healthcare system, especially the funded healthcare system in developing world, is really structured in silos. So it would be HIV, TB, malaria, maternal and child health, reproductive health, and so on. And therefore, any resources coming into the system sort of comes down through a silo of either HIV or TB or malaria. And at the end of the day, the health system needs to respond in, so if it's a community health system, it's one community health system that you have one community health worker that goes into this number of households, and they must look at the health of the people. But because they're funded to do HIV, you might find that they focus more on HIV programming, or they focus more on TB contact tracing or malaria. And what happens then is that you have some areas that are over-resourced because the vertical programs are focusing there. And you have other areas in the community health system that are under-resourced because they probably are not a priority area for investment. Now, what that does is then you have an imbalance in terms of how the community health or the primary healthcare system looks from one part of the country to the other. And my call out for this was that why don't we look at the primary healthcare systems and community health systems especially, and invest in it ubiquitously, right? So that if you have a community health system in village A, it looks exactly the same as village B. And I think in this pandemic situation, we've seen how important that would have been if we had that equitable kind of spread of resources.